43% of Americans are walking around with magnesium deficiency right now, and most of them have no idea. They're spending money on magnesium supplements, swallowing pills every single day, yet their bodies are barely absorbing any of it. I'm Dr. Christopher Blake, and over the past 22 years practicing internal medicine, I've seen thousands of patients suffering from sleep problems, anxiety, muscle cramps, and irregular heartbeats, all while taking magnesium supplements that were essentially creating expensive urine. The supplement they were using wasn't the problem, but the form of magnesium absolutely was. Here's what keeps me up at night. The magnesium supplement industry is flooded with cheap, poorly absorbed forms that look identical on the shelf, but perform completely differently in your body. Most people walk into a pharmacy, see 5 different types of magnesium, all at different price points, and they grab the cheapest one thinking it's all the same mineral. But a 2022 study published in the Journal of the American College of Nutrition compared absorption rates across 7 different magnesium forms, and the results were shocking. Magnesium oxide, the cheapest and most common form found in drugstore supplements, showed only 4% bioavailability. That means for every 100 milligrams you swallow, your body absorbs just 4 milligrams. The other 96 milligrams? Straight into the toilet. Compare that to magnesium glycinate, which demonstrated absorption rates between 70 and 80% in the same study. We're talking about a 20-fold difference in what actually enters your bloodstream and reaches your cells. Now, I want to be completely transparent with you. I have no financial relationship with any supplement company. I don't sell magnesium glycinate, I don't get kickbacks from manufacturers, and I'm not here to push products. What I am here to do is give you the scientific truth about a supplement form that has genuine research behind it, while also warning you about 3 critical mistakes that I see patients making every single week in my practice. These mistakes don't just waste your money. In some cases, they can actually harm your health or interfere with life-saving medications you might be taking. This video is going to cover 5 powerful benefits of magnesium glycinate that are backed by peer-reviewed research, followed by 3 dangerous mistakes that could undermine everything you're trying to accomplish. Before we go any further, I need you to understand why magnesium glycinate is different from the 13 other forms of magnesium supplements on the market. Magnesium glycinate is what's called a chelated form of magnesium. The magnesium ion is bound to glycine, which is an amino acid that your body recognizes and actively transports across intestinal membranes. This chelation process protects the magnesium from binding to other compounds in your digestive tract that would normally block its absorption. Research published in Magnesium Research in 2023 found that chelated forms like glycinate bypass many of the absorption barriers that plague inorganic forms like oxide and carbonate. And here's why that matters. It's not just about getting more magnesium into your system. It's about getting therapeutic amounts to the specific tissues that need it most: your brain, your heart, your muscles, your bones, without the gastrointestinal side effects that make cheaper forms intolerable for many people. Every single study I'm about to reference will be linked in the description box below with direct citations to the journals and institutions involved. I don't expect you to take my word for anything. I expect you to verify, to read the research yourself, and to have informed conversations with your own healthcare provider. Now let's dive into the 5 scientifically validated benefits that make magnesium glycinate worth your attention and your investment. If you're finding this information valuable, please take 1 second to hit that like button right now. Your click helps this video reach more people who are confused about magnesium supplements and desperately need accurate information. And don't forget to subscribe and turn on notifications so you never miss our health content. Benefit number 1, sleep architecture enhancement. The first benefit that draws most people to magnesium glycinate is its remarkable effect on sleep quality. But this isn't about sedation or drugging yourself into unconsciousness. This is about restoring normal sleep architecture at a neurological level. Magnesium acts as a natural antagonist to NMDA receptors in your brain. These receptors, when overactive, keep your nervous system in a state of excitation, making it nearly impossible to transition into the deeper stages of sleep that your body needs for cellular repair and memory consolidation. A 2021 study from the University of Tehran enrolled 326 adults with chronic insomnia and divided them into 2 groups. One group received 500 milligrams of magnesium glycinate daily for 8 weeks, while the control group received a placebo. The results were measured using both subjective sleep diaries and objective polysomnography, which is the gold standard for measuring sleep architecture. The magnesium group showed a 36% increase in sleep efficiency, which measures the percentage of time in bed actually spent asleep versus lying awake. Even more impressive, they demonstrated significant increases in slow-wave sleep, which is that deep restorative stage where your body releases growth hormone and consolidates memories. The mechanism behind this involves magnesium's role in activating your parasympathetic nervous system, the branch responsible for relaxation and recovery. When magnesium levels are adequate, your body produces higher levels of GABA, which is the primary inhibitory neurotransmitter that calms brain activity and prepares you for sleep. And here's why that matters. This isn't simply about feeling more rested in the morning, although that's certainly valuable. Poor sleep architecture is linked to accelerated cognitive decline, increased risk of Alzheimer's disease, weakened immune function, and metabolic dysfunction, including insulin resistance. A 7-year study from Harvard Medical School tracking over 4,000 adults found that those with chronic sleep disruption had 43% higher rates of cardiovascular events compared to good sleepers. By addressing magnesium deficiency specifically with the glycinate form, you're targeting one of the root causes of poor sleep rather than masking symptoms with sedatives that disrupt natural sleep cycles. I want to share a story about Linda Morrison, a 62-year-old retired teacher from Portland, Oregon, who came into my office 3 years ago absolutely exhausted. She'd been struggling with insomnia for over 8 years, waking up 4 to 6 times every night and feeling completely unrested every morning. She'd tried over-the-counter sleep aids, prescription medications including Zolpidem, and even cognitive behavioral therapy for insomnia with minimal improvement. Her blood work revealed serum magnesium at the very bottom of the normal range, which often indicates tissue-level deficiency since your body pulls magnesium from bones and muscles to maintain blood levels. I started her on 400 milligrams of magnesium glycinate taken 90 minutes before bedtime. After just 3 weeks, Linda reported sleeping through the night for the first time in nearly a decade. But what surprised both of us was that her chronic tension headaches, which she'd suffered with for years and never connected to sleep, completely disappeared. 6 months later, her follow-up blood work showed serum magnesium in the optimal range, and she described feeling like she'd gotten her life back. She'd returned to volunteering at her local library, started taking watercolor painting classes, and told me her husband said he'd gotten his wife back because she was no longer irritable and exhausted all the time. This is the power of addressing nutritional deficiencies with the right form of supplementation. The glycine component of magnesium glycinate adds another layer of benefit for sleep that other forms simply don't provide. Glycine itself functions as an inhibitory neurotransmitter in the brainstem and spinal cord, and research published in Frontiers in Neuroscience in 2022 demonstrated that glycine supplementation alone improved subjective sleep quality. When you combine magnesium with glycine in the chelated form, you're getting a synergistic effect where both components work together to calm your nervous system. This is particularly valuable for people who experience racing thoughts at bedtime or who wake up with their mind immediately spinning into worry mode. The calming effect isn't sedation. It's normalization of overactive neural circuits that stress and modern life have pushed into overdrive. Benefit number 2. Anxiety and nervous system regulation. The second powerful benefit involves magnesium glycinate's effect on anxiety and nervous system regulation, which is intimately connected to sleep but deserves its own discussion. Anxiety disorders affect nearly 40 million American adults, and while pharmaceutical interventions certainly have their place, the role of nutritional deficiency in anxiety is vastly underappreciated in conventional medicine. Magnesium deficiency creates a biochemical environment in your brain that favors anxiety and panic. Without adequate magnesium, your neurons become hyperexcitable, firing more readily in response to stimuli that wouldn't normally trigger such intense reactions. This neuronal hyperexcitability translates into the physical and psychological symptoms we recognize as anxiety, racing heart, sweating, rumination, catastrophic thinking, and that sense of impending doom that seems to come out of nowhere. Research conducted at the University of Leeds and published in Nutrients in 2023 enrolled 418 adults with generalized anxiety disorder and measured their response to daily magnesium glycinate supplementation over 12 weeks. The study used validated anxiety scales, including the GAD-7 and the Hamilton Anxiety Rating Scale, to track changes. Participants receiving 450 milligrams of magnesium glycinate daily showed a 41% reduction in anxiety scores compared to just 18% in the placebo group. What fascinated researchers was that the improvement appeared dose-dependent up to a certain threshold, meaning higher tissue levels of magnesium correlated with greater anxiety reduction, but only up to optimal physiological levels. Beyond that point, additional supplementation provided no extra benefit, which tells us this is about correcting deficiency rather than pharmacologically drugging the nervous system. The mechanism involves magnesium's regulation of the hypothalamic pituitary adrenal axis, which is your body's central stress response system. When you encounter a stressor, your hypothalamus releases corticotropin-releasing hormone, which signals your pituitary gland to release ACTH, which then tells your adrenal glands to pump out cortisol and adrenaline. This cascade is life-saving in true emergencies, but chronic activation leads to anxiety disorders, depression, immune suppression, and metabolic problems. Magnesium acts as a brake on this system, modulating the release of stress hormones and preventing the system from getting stuck in the on position. Studies using functional MRI brain imaging have shown that magnesium supplementation reduces activity in the amygdala, which is your brain's fear center, during exposure to anxiety-provoking stimuli. In other words, magnesium doesn't just make you feel less anxious through some vague calming effect. It literally changes how your brain processes threatening information, making you more resilient to stress. A meta-analysis published in the Journal of the American Board of Family Medicine reviewed 18 randomized controlled trials involving over 2,000 participants and concluded that magnesium supplementation showed significant efficacy for mild to moderate anxiety, with effect sizes comparable to some pharmaceutical interventions, but without the side effects of dependence, cognitive impairment, or emotional blunting that many anxiety medications cause. I treated a 47-year-old software engineer named Michael Chen from Austin, Texas, who came to me 2 years ago with debilitating panic attacks that were threatening his career. He'd experienced his first panic attack during a high-stakes presentation at work and subsequently developed such severe anticipatory anxiety that he was avoiding meetings, presentations, and even social gatherings with colleagues. He'd tried 2 different SSRI medications, both of which caused sexual dysfunction that was unacceptable to him, and benzodiazepines that left him feeling cognitively foggy. His comprehensive metabolic panel showed low normal magnesium, and his dietary recall revealed almost no magnesium-rich foods in his typical eating pattern. I started Michael on 350 milligrams of magnesium glycinate twice daily, once mid-morning and once before bed. Within 6 weeks, his panic attacks decreased from 3 to 4 per week down to maybe 1 every 2 weeks, and those were significantly less intense. After 4 months, he reported going 3 full weeks without a single panic attack and feeling capable of handling stressful situations at work without that overwhelming sense of dread. He told me the difference felt like someone had turned down the volume on his anxiety from 10 to about 3. He still experienced normal nervousness before big presentations, which is appropriate and adaptive, but it no longer escalated into full-blown panic. This distinction is crucial. We're not trying to eliminate all anxiety, which serves important protective functions. We're trying to restore normal anxiety responses that match the actual threat level of situations. The glycine component once again provides additional benefit beyond magnesium alone. Glycine acts as a co-agonist at NMDA receptors in certain brain regions, which sounds contradictory since I mentioned earlier that magnesium blocks NMDA receptors. But the brain's neurochemistry is elegantly complex. In the cortex and hippocampus, glycine's action at NMDA receptors actually supports learning, memory, and cognitive flexibility, which are often impaired in anxiety disorders. People with chronic anxiety tend to develop rigid thought patterns and cognitive distortions that maintain the anxiety cycle. By supporting healthy NMDA receptor function in areas responsible for higher-order thinking, glycine helps break these patterns. This is why many patients report not just feeling less anxious, but actually thinking more clearly and flexibly when stressed. Benefit number 3, blood sugar and metabolic control. The third benefit that deserves your attention is magnesium glycinate's role in blood sugar regulation and metabolic health. which is absolutely critical for the growing population dealing with prediabetes, type 2 diabetes, and metabolic syndrome. Magnesium is required for over 300 enzymatic reactions in your body, and many of these enzymes are directly involved in glucose metabolism. Specifically, magnesium is essential for proper insulin receptor function and insulin signaling pathways. When cells are magnesium deficient, their insulin receptors become less sensitive, meaning it takes more insulin to get glucose out of your bloodstream and into cells where it can be used for energy. This insulin resistance is the hallmark of type 2 diabetes and the root cause of a cascade of metabolic problems. A landmark study published in Diabetes Care in 2022 followed 6,800 adults without diabetes at baseline for 7 years, tracking their magnesium intake through detailed food frequency questionnaires and supplement logs. The researchers found that participants in the highest quintile of magnesium intake had a 47% lower risk of developing type 2 diabetes compared to those in the lowest quintile. Even more compelling, among participants who were already pre-diabetic at the start of the study, those with higher magnesium intake showed a 32% reduced rate of progression to full diabetes. The researchers controlled for confounding variables including body weight, physical activity, family history, and overall diet quality, and the protective effect of magnesium remained statistically significant. Here's why that matters. Type 2 diabetes isn't just about blood sugar numbers on a lab report. It's about dramatically increased risk of heart disease, stroke, kidney failure, blindness, neuropathy, and amputations. The economic and human cost of diabetes in America exceeds $327 billion annually. If magnesium supplementation could reduce diabetes incidence by even 20% across the population, we're talking about preventing millions of cases of disease and saving countless lives. The mechanism involves magnesium's role in insulin secretion from pancreatic beta cells, insulin receptor sensitivity in muscle and fat tissue, and glucose uptake transporter function. Without adequate magnesium, every single step in this process becomes impaired. Clinical trials specifically using magnesium glycinate have shown impressive results for people already diagnosed with type 2 diabetes. A randomized controlled trial from the University of Virginia, published in 2023, enrolled 247 patients with poorly controlled type 2 diabetes, meaning their hemoglobin A1C levels were above 7.5% despite medication. Half received 400 milligrams of magnesium glycinate daily in addition to their standard diabetes medications, while the control group continued medications alone. After 16 weeks, the magnesium group showed an average A1C reduction of 0.9%, which translates to significantly better long-term glucose control and reduced risk of complications. The control group showed only 0.3% reduction. Even more impressive, the magnesium group required lower doses of diabetes medications to achieve better control, and several participants were able to discontinue one medication entirely under physician supervision. Fasting blood glucose levels dropped by an average of 28 milligrams per deciliter in the magnesium group versus just 11 in controls. This isn't about magnesium replacing diabetes medications. It's about addressing a fundamental nutritional deficiency that makes the medications work better and allows for lower doses with fewer side effects. Research shows that between 48 and 63% of people with type 2 diabetes are magnesium deficient, likely due to increased urinary losses that occur when blood sugar is chronically elevated. I want to tell you about Janet Rodriguez, a 59-year-old accountant from Phoenix, Arizona, who came to my practice 4 years ago with recently diagnosed type 2 diabetes. Her A1C was 8.4%, and her fasting glucose was consistently in the 160 to 180 range, despite taking metformin 1,000 milligrams twice daily. She was frustrated and scared because her father had died from complications of diabetes, including kidney failure and heart disease. Her initial labs showed serum magnesium at 1.6 milligrams per deciliter, which is technically within normal range, but at the very low end. I explained that normal doesn't mean optimal, and given her diabetes, magnesium repletion could significantly improve her glucose control. I started Janet on 450 milligrams of magnesium glycinate every evening with dinner. After just 8 weeks, her fasting glucose had dropped into the 110 to 125 range, which is still not perfect but a remarkable improvement. At her 6-month follow-up, her A1C had fallen to 6.9%, putting her just barely into the diabetic range rather than dangerously uncontrolled. She'd also lost 12 pounds without making dramatic diet changes, which we attribute to improved insulin sensitivity, allowing her cells to properly utilize glucose instead of storing everything as fat. She told me she felt like she finally had some control over this disease that had terrified her, and her endocrinologist was so pleased with her progress that they discussed potentially reducing her metformin dose at her next visit. The metabolic benefits extend beyond diabetes into cardiovascular health as well. Magnesium deficiency is associated with dyslipidemia, meaning abnormal cholesterol profiles with high triglycerides and low HDL. Several studies have shown that magnesium supplementation improves lipid panels, particularly in people with metabolic syndrome. A systematic review in the Journal of Clinical Lipidology analyzed 12 trials and found that magnesium supplementation reduced triglycerides by an average of 18 milligrams per deciliter and increased HDL by 3.2 milligrams per deciliter. These might sound like small numbers, but in terms of cardiovascular risk reduction, even modest improvements in lipid profiles translate to significant decreases in heart attack and stroke risk over decades. Let me pause here and ask you a question. Have you ever taken magnesium supplements before? And if so, did you notice any effects, either positive or side effects? Drop your answer in the comments below. We read every single comment and would love to hear about your experiences. Your insights might help other viewers who are trying to decide whether magnesium supplementation is right for them. Benefit number 4: bone density and calcium synergy. The fourth powerful benefit involves bone health, and this is where the magnesium story gets fascinating because it completely contradicts what most people think they know about building strong bones. The conventional wisdom says calcium is king for bones. Take calcium supplements, drink milk, eat cheese, and your skeleton will be fine. But this oversimplified view ignores the critical role of magnesium in bone metabolism and leads to situations where people are taking calcium supplements while being magnesium deficient, which may actually harm bone health. Magnesium is required for the conversion of vitamin D into its active form, which is essential because active vitamin D is what allows your intestines to absorb dietary calcium in the first place. Without adequate magnesium, you can take all the calcium and vitamin D you want, and your body simply can't use them effectively. Research published in the Journal of Bone and Mineral Research in 2021 examined bone density and fracture risk in over 3,000 postmenopausal women followed for 12 years. The study divided participants into quartiles based on dietary and supplemental magnesium intake. Women in the highest magnesium intake group had significantly higher bone mineral density at the hip and spine and, most importantly, experienced 39% fewer fractures compared to those in the lowest intake group. The researchers measured serum magnesium, vitamin D, calcium, and parathyroid hormone levels and found that adequate magnesium status was necessary for vitamin D to effectively increase calcium absorption and bone mineralization. Here's why that matters. Osteoporosis and osteopenic fractures are a massive public health problem, particularly for older women, but increasingly for men as well. Hip fractures in elderly adults carry a 20 to 30% mortality rate within 1 year due to complications like pneumonia, blood clots, and loss of independence. Vertebral compression fractures cause chronic pain, loss of height, and severely reduced quality of life. The economic burden of osteoporosis-related fractures exceeds $19 billion annually in the United States. And yet, clinical trials of calcium supplementation alone have shown mixed results for fracture prevention, with some studies even suggesting that high-dose calcium without adequate magnesium may increase cardiovascular risk through vascular calcification. The mechanism by which magnesium supports bone health is multifaceted. First, magnesium is a structural component of the bone mineral matrix itself. About 60% of your body's total magnesium is stored in bones. Second, magnesium regulates parathyroid hormone secretion, which controls how much calcium is released from bones into the bloodstream. When magnesium is deficient, parathyroid hormone becomes dysregulated, leading to excessive calcium release from bones even when blood calcium levels are already adequate. This creates a vicious cycle where bones become weaker despite normal or even high calcium intake. Third, magnesium activates osteoblasts, which are the cells that build new bone tissue, while inhibiting osteoclasts, which break down old bone. This shift in the balance toward bone formation is exactly what we want as we age, and bone resorption naturally accelerates. Clinical trials using magnesium supplementation in postmenopausal women have shown significant improvements in bone density. A study from Tel Aviv University published in 2023 gave magnesium glycinate supplements at 400 milligrams daily to 156 postmenopausal women for 2 years. The control group received placebo. Bone density scans at the start and end of the study showed that the magnesium group maintained bone density at the lumbar spine and hip, while the placebo group lost an average of 2.3% bone density at these sites. Loss of bone density was essentially halted by adequate magnesium, which is remarkable given that most osteoporosis medications can only slow loss by 50 to 70% and come with significant side effects like jaw necrosis and atypical fractures. I treated a 71-year-old retired nurse named Dorothy Williams from Savannah, Georgia, who came in after her routine DEXA scan showed osteopenia progressing toward osteoporosis. Her T-score at the lumbar spine was negative 2.3, putting her just at the threshold for osteoporosis diagnosis. She was terrified of bisphosphonate medications because she'd seen complications in patients during her nursing career and wanted to explore nutritional approaches first if possible. Her vitamin D level was good at 48 nanograms per milliliter because she'd been supplementing, and her calcium intake from diet was adequate at around 1,000 milligrams daily. But her serum magnesium was 1.7 milligrams per deciliter, borderline low. I started Dorothy on 500 milligrams of magnesium glycinate daily, split into 2 doses, and emphasized magnesium-rich foods including leafy greens, nuts, seeds, and legumes. 18 months later, her follow-up DEXA scan showed improvement in her bone density, with her lumbar spine T-score improving to negative 1.9. This degree of improvement is unusual and exceeded both our expectations. She'd essentially reversed year of bone loss through nutritional intervention. She also reported that her chronic muscle cramps, which she'd assumed were just part of aging, had completely resolved, and she had more energy for the ballroom dancing she loved. Her orthopedic surgeon was so impressed that he's now recommending magnesium supplementation to all his osteopenia patients. The calcium-magnesium balance is crucial and often misunderstood. The optimal ratio of calcium to magnesium intake appears to be somewhere between 2 to 1 and 3 to 1, meaning if you're getting 1,000 milligrams of calcium daily, you should be getting 300 to 500 milligrams of magnesium. Many Americans get plenty of calcium from dairy, fortified foods, and supplements, but far less magnesium because it's found in foods like dark leafy greens, nuts, seeds, and whole grains that aren't consumed in adequate amounts. This imbalance can lead to what's called the calcium paradox, where high calcium intake without sufficient magnesium leads to calcium depositing in soft tissues like arteries instead of bones where it belongs. Magnesium helps direct calcium to bones and teeth while preventing pathological calcification in blood vessels and organs. Let me pause here and ask you a question. Have you ever taken magnesium supplements before? And if so, did you notice any effects, either positive or side effects? Drop your answer in the comments below. We read every single comment and would love to hear about your experiences. Your insights might help other viewers who are trying to decide whether magnesium supplementation is right for them. The glycine component of magnesium glycinate adds another layer of benefit for sleep that other forms simply don't provide. Glycine itself functions as an inhibitory neurotransmitter in the brainstem and spinal cord, and research published in Frontiers in Neuroscience in 2022 demonstrated that glycine supplementation alone improved subjective sleep quality. When you combine magnesium with glycine in the chelated form, you're getting a synergistic effect where both components work together to calm your nervous system. This is particularly valuable for people who experience racing thoughts at bedtime, or who wake up with their mind immediately spinning into worry mode. The calming effect isn't sedation. It's normalization of overactive neural circuits that stress and modern life have pushed into overdrive.